Fish oil is antifreeze for a fish. Let me start there. Why? Because I throw you in frigid water, you would freeze because we have a lot of water in us. Water freezes at 32 degrees. So nature can either use alcohol, in which case you'd have a drunk fish, right? Or long chain essential oils, because they don't freeze either. And then Dr. Rowan, who co-wrote the PEO solution for parent essential oils, the essential again, is a vegetarian. He goes, Brian, I'll prove that it's antifreeze. Guess how much less DHA is in a warm water fish at 70 degrees? Because there's rivers and lakes that are 70 degrees. I said, I don't know. I'm sure it's a heck of a lot less. He goes, more than a heck of a lot. 14 times less. 14 times less. What are we doing? We're taking supraphysiologic overdoses of DHA, and I can give you the numbers the brain uses in a little while. You won't believe how little it is. And it's going bad immediately. So when it goes bad immediately, DHA spontaneously oxidizes. And actually, Dr. Holbert's done a lot of work with this. He's from Australia. He's a scientist whose work I quoted immensely in PEO Solution. Brilliant guy. And this work never makes it into the clinical medical magazines like JAMA, New England Journal of Medicine, that the clinical physicians, at least in America, read. It stays in the hardcore science like Journal of Biologic Chemistry, Journal of Lipids, the magazines and the publications I read, or the medical textbooks, but the physicians don't read them anymore after they're out of medical school. And the biggest mistake the whole medical community made early on was, remember I told you it's 4-1 in all the tissues, the majority of the tissues and organs, like the brain, not the brain, but the liver, the kidneys, the heart. They thought all the parents would be converted to derivatives. So DHA, EPA, like in fish oil, is called a derivative. You start with the parent. It's like the parents in the offspring, and they get bigger. They elongate. It's not shorter, it's longer. They thought all of them would be converted to derivatives. So let's make it easy on the body. Give everybody a ton of derivatives. You make it easy, except today, with high resolution chromatography, 0.1% go to derivatives. So from those parents, 1 part in 1,000 go to derivatives, almost nothing.
Let's just,
and the parents stay in parent form.
Brian, let me just, because you've thrown up a lot there, and we're
yes,
going to come back and talk. You have. And I just want to come back to my original thing about fats, and you've made a very strong point about the importance of omega-6 and how disproportionately high it is. What's your view of the demonization of saturated fats through our public health story?
Yeah, you're right. It's been demonized. Now, a saturated fat can't combine with anything, so it is your ideal fat to fry in because it can't get screwed up. It can't become rancid. So I love cooking, especially deep frying coconut oil, which is 93% saturated. Wonderful oil. You can use monounsaturated, meaning there's one double bond, like avocado oil. Olive oil can be used, but not the best because it has a lower smoke point. So avocado oil is 440 degrees before it starts smoking. Coconut oil is 400 degrees. And you want to make sure they're organic, so there's no chemicals and they're not poison when you're eating them. And I calculated just 1 teaspoon of oil with 1% processing will have, sitting at the gate outside those 100 trillion cells, 30,000 cells, 30,000 molecules rather, of bad fat wanting to come in. So I know martial arts, you put 30,000 people in front of me, I'm dead. They're just going to bowl me over. Thank God they don't go into the cell, because Dr. Lanz proved with radioisotope testing in 1990 the amount of bad oils in the cell is proportional to what you're eating. So if I'm eating half good organic oils and half supermarket oils, it's 50-50 in the cell. Even though they're all waiting to get in, they don't get in. But they cause inflammation.
Can I ask you another question about the
but
fats?
Saturated fat, no issue, and there's no saturated fat in an arterial clot. Excellent question. It's 87% omega-6 that's been processed. Is it an arterial clot? This is in the heart disease journals, and nobody is saying this. Even the American Heart Association, back in 2009, 15 years ago, said to call omega-6 inflammatory is wrong. It is highly anti-inflammatory. You have a naive understanding of biochemistry. So this is how bad our medical profession is in America. And then unfortunately, the rest of the world follows us. They forgot what was said 15 years ago. But it's like in the medical profession, it always starts with me. There is no history. I'm an engineer by training. And you watch the engineering shows, and it's always the brilliant invention today was based on the brilliant engineer that came up with this 10 years ago, who stood on the shoulders of the genius engineer from 50 years ago. In medicine, nope. There's no history. It's just me, me, me. And look what's happening. America's the sickest developed country.
Oh, yeah. Well, I think it's also interesting what you just said there about clots being primarily omega-6.
87%.
87%. And yet the heart foundations will be telling us to avoid saturated fat.
There's none in there.
But to consume, and this is actually part of what I often say, it's a great business model, just not a very good health model, that the advice by the Heart Foundation to avoid saturated fat and eat canola oil, safflower oil, sunflower oil, which makes up the majority of the clot, is quite a remarkable public health message.